Hi, everyone. I'm Alicia Broadbent, and welcome to the STEMS Monthly Minute. Each month, we will share a short update focused on practical topics that support patient care and strengthen our EMS system across Allegheny, Cattaraugus, and Chautauqua counties. Today, we are talking about effective handoff reports and how using the MIST format can make the process clearer, faster, and more consistent. Even in high acuity situations, the first 30 seconds of communication can shape everything that follows. A clear, structured handoff helps the receiving team prioritize quickly, reduces the risk of missed information, and supports smoother transitions of care. We have all experienced situations where key details come out later rather than during the initial report. Using a consistent structure like MIST helps prevent that and ensures we all are speaking the same clinical language. Across our region, the EMS timeout process gives EMS about 30 seconds to deliver a focused report. That is not a lot of time. Using MIST ensures you communicate the most critical information efficiently and consistently. We'll walk through what MIST stands for, and then we'll break down each component further. M is mechanism or medical complaint. I is injuries and inspection. S is signs and symptoms. T is treatments. First is M, mechanism or medical complaint. Start with the patient's age and sex and clearly state the mechanism of injury or medical complaint. For example, 65-year-old male, chest pain for 1 hour. Or 28-year-old female, high-speed MVC, restrained driver. This immediately frames the situation for the receiving team. It tells them why you are here and what category of problem they are dealing with. If it is time sensitive, include that detail right away, such as time of onset or last known well. Next is I, injuries or inspection. For trauma, give a quick head-to-toe summary of significant injuries. For medical calls, provide key assessment findings and time of onset when relevant. For example, deformity to left femur, abdominal tenderness, no obvious head trauma. Or sudden onset right-sided weakness, 45 minutes ago, speech slurred. Focus on findings that will influence immediate decision-making. This is not the time for a full narrative. It is about highlighting what matters most right now. Next is S, signs and symptoms. Share the first set of vital signs and any significant changes during transport. Include important data such as blood pressure, heart rate, respiratory rate, SpO2, glucose, GCS, EtCO2 when applicable. If there were trends, state them clearly. For example, initial blood pressure 88 systolic improved to 102 after fluid bolus. Trends are often more important than single numbers. This gives the ED team a quick picture of stability and trajectory. T is treatments. Briefly state what interventions were performed and how the patient responded. For example, IV established 500 milliliters normal saline administered, minimal improvement in blood pressure. Or oxygen applied with improved saturation from 88 to 95%. This helps the receiving team understand what has already been done and what still needs attention. Here is what a complete MIST report might sound like. 72-year-old male, sudden onset chest pain while shoveling snow approximately 30 minutes prior to arrival. Pale and diaphoretic on EMS arrival. Initial blood pressure 90/60, heart rate 110, SpO2 93% on room air, IV established, 324 milligram aspirin given, 500 milliliter normal saline administered with blood pressure improving to 104 systolic, pain unchanged during transport. That entire report takes about 20 to 30 seconds and provides the critical information the ED needs immediately. A few common challenges we see during handoff include leading with minor details instead of the mechanism or chief complaint, forgetting to include time of onset in stroke or trauma, not clearly stating trends and vital signs, and omitting the patient's response to treatment. Using MIST consistently helps improve these issues and keeps the report focused and efficient. Using MIST during the EMS timeout helps reduce omissions, improves clarity, and strengthens collaboration between EMS and hospital staff. It ensures that even in a high acuity situation, the most critical information is communicated quickly and consistently. Strong handoffs are a patient tool. They protect our patients and reflect the professionalism of EMS providers across the region. Thank you for everything you do each day. If there are topics you would like to see covered in future STEMS Monthly Minutes, please reach out to us. STEMS is always here to help you. Thank you.